House Democrats will symbolically vote to protect abortion rights next week. The Women's Health Protect Act was passed in the House earlier this year, but died in the Senate. The bill's sponsor says it will be brought back with the Ensuring Access to Abortion Act on Tuesday, both on Tuesday. Neither, though, is expected to get enough Republican support in the Senate to pass.
I can't think of anything that's much more extreme. The court's decision has already been received by Republicans in Congress as a green light to go further and pass a national ban.
President Joe Biden does what he can to protect abortion rights. He's calling on Congress to restore access to abortion and urged Americans to go vote. The president also signed an executive order yesterday. It tells the Department of Justice and Health and Human Services to push back, specifically on efforts to limit access to federally approved abortion medication or travel across state lines for procedure. It also directs agencies to help doctors and insurers learn how and when they have to share privileged patient information. Plus, it tells the FTC to protect the privacy of people looking for information online. It also creates a task force for federal efforts to protect abortion rights and gets volunteer lawyers to help people understand the new state laws. News 8's Lakin McGee, she's joining us live this morning because Lakin spoke with a professor at Indiana University about how the order impacts our state here in Indiana. Lakin.
Hey, Hannah, yeah, I sure did. And this professor says that this is as much as President Biden can do when it comes to an executive order. So this professor, her name is Jody Madeira. She says states should not be restricted when it comes to medication abortion because she says it is actually the jurisdiction under the Food and Drug Administration. So we do know that there are 9 states with abortion bans right now, and there are 12 about to restrict or even ban abortion in the next several weeks. So she says Indiana has tried to do this in the past before. And here's what's happening now. Governor Holcomb and the General Assembly will begin to discuss and look at the bill discussing abortion starting July 25th. Madeira thinks they will take a look at what people are saying and base a decision off of the thoughts of Hoosiers. So I asked her, what does this mean for the Hoosier state?
I think that what we're going to see is we're going to see mobile clinics, perhaps, on the Illinois side of the border to facilitate Indiana women's access to abortion. I think that we're going to see these groups of private pro bono lawyers who might help people in Indiana cross the state lines to Illinois or other states to get abortion procedures. And I think we're going to see guarantees from the federal government that will ensure that we have access to medication abortion, emergency contraception, and IUDs.
She says she thinks we're on the verge of looking at a federal law that will preserve or even codify the right to an abortion for all women in all states. Last year, the Hoosier state had the highest number of abortions performed since 2011. Data from the Indiana Department of Health shows 8,414 women obtained abortions, and of those, 465 came from out of state. All but 105 of those abortions came before the pregnancy hit the 14-week mark, and more than half of those were medical abortions. Now, President Biden's executive order does not restore access to abortions in the states that have already banned it, but instead it lessens or even takes away the penalties for women who are trying to seek an abortion. I'm Lakin McGee for WishTV, WishTV.com, and follow us on Facebook.